Hi there, Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer for my whole career, over 20 years. So I wanted to talk about the subject of leucovorin that's used in oncology. So what a lot of people don't know is that, and leucovorin is one of the drug regimens that's commonly used in, say, colorectal cancer, FOLFOX, combined with 5-fluorouracil or 5-FU, FOLFIRI. It's used in pancreatic cancer, FOLFIRINOX, gastric cancer, the FLOT protocol. So what a lot of people don't know is leucovorin is a drug name for vitamin B9, folinic acid. So when you hear about folic acid being used, for say preventing neural tube defects or other things, what leucovorin is a more activated form of folic acid called folinic acid. So it's been around, it's been used since the 50s, like for rescuing with like protocols with methotrexate. And then they learned later on, probably in the 80s or so, where when they combine it with the chemo drug 5-FU, it enhanced the effects. So it's an enhancing vitamin B9. And so there's always this kind of these pushbacks I'm finding back and forth. Well, vitamins, should they not be used together with chemo in conventional oncology? And then you have this name that's a drug name, but it's actually vitamin B9, folinic acid, that you can use potentially to treat somebody who has folic acid deficiencies. And yet the other part that people are probably not piecing together is that while it may not be a direct antioxidant, so meaning directly quenching free radicals, because people are always commenting antioxidants in chemo, but indirectly, it actually could make glutathione. It could actually help to restore antioxidants. There's been papers showing that it can decrease oxidative markers, decrease inflammation. So this area with when you hear about antioxidants and be careful. Well, here's a vitamin B9, and an activated form that works really well. I've been hearing that it's also being discussed to help with autistic demographic groups. And so it's that kind of vitamin that you can give to children. And yet in oncology, they use a really big dose of it, not small. And for what reason? To enhance the effects of 5-fluorouracil, and in colorectal cancer protocols, and pancreatic cancer protocols, and gastric protocols. It could potentially use to rescue with another chemo called methotrexate. And yet, so the question then lies, how about other vitamins?